Thank you, Dr. Hayes and Dr. Saw again for inviting me here. I talked about this topic last year at this conference, and the psychosocial considerations after SCAD haven't really changed that much in a year. I think the one thing that I would say is that with each year and each new research project, we're just getting more and more data about how important it is to attend to psychosocial considerations in this population in particular. So here are the aims of this talk. I also want to thank Katie Sears-Edwards from Stanford and Catherine Leon, with whom I've developed some of these slides from previous talks. Okay? So I want to talk just briefly about what are SCAD patient psychological experiences. We've already had several people really speak to this over the conference already, so I'm not going to belabor the point. But just a quick overview. So we did this survey, which was published last year, of 409 SCAD survivors, most of them female. And we got participation from a number of different countries. So that's where part of this information comes from. We asked them lots of questions about their psychosocial experiences, stress, and so forth. Now, I plagiarized this slide from yesterday's talk. This is the exact same thing. Sorry about that. But stress, certainly a risk factor for SCAD. And we know that stress plays a role in cardiovascular disease generally, plays a role in SCAD in particular. We, again, found that the people who responded to our survey were at least moderately depressed in the year prior to SCAD, and certainly lots of instances of stress in the 2 weeks prior to SCAD. But here's the other piece of that, is that SCAD itself is stressful, right? So even if you weren't stressed before, certainly having a heart attack that you did not expect to have, and having to go through all that entails can be really stressful and traumatic. And so here are some of the most frequent words that our respondents use to describe the experience of SCAD itself. So stressful, frightening, fraught with uncertainty. And we also asked people to rate on a scale of 1 to 10 what the stress impact of their SCAD was. And most of them, so the mean here was about 8.4 or something, right? That's how stressful SCAD was. But we also asked people to rate how stressed they continue to be about their heart health. And so even years later, people's heart health is rated at about a 6.2, right? That's how stressed people continue to be. And as I discussed yesterday, stress is the gateway experience for anxiety and depression. Again, not going to belabor that point, but on a molecular level, there are contributions that stress makes to anxiety and depression. Here's something that I think is super important about the experience of SCAD survivors and the kinds of things that are helpful to SCAD survivors afterwards, is that SCAD was something that, for most of us, we are completely unprepared for, right? And the thing about trauma and stress is that the things that we're unprepared for tend to be the most stressful and the most traumatic, right? If we know that a hurricane is coming, that's a different experience from having, a tornado touch down on your house with no warning. Does that make sense? So, and when we asked our SCAD survivors about risk factors, 82.8% of them said they had no known risk factors at the time of their SCAD. In other words, they were unprepared. There was nothing on their radar about whether SCAD was in their future, right? Another thing that's stressful for SCAD survivors is that what we found, unfortunately, is that a number of our survivors who showed up in emergency departments were discharged without a diagnosis. And that was particularly true for younger women. So there's been some mention of that in other data too. Not this particular statistic, but the idea that young women who don't look like they're having a heart attack are not tended to in the same way that other people in the population might be. Another factor that may add to stress is just people not having great information at the time that they're diagnosed. For the most of our survivors, 63% of them just got verbal information from their doctor at the time of their SCAD. And when we asked them, was that enough? Do you feel like you got enough information about SCAD at the time of your diagnosis? Most of them said, no, that we needed more information, that wasn't quite enough, right? So having insufficient information at the time of SCAD can really add to the psychological burden of SCAD, making it more frightening, more confusing. Another thing is people felt like their family, their friends, didn't really understand SCAD either. And so that makes it tougher. So, surprise or not, a lot of people experienced emotional distress post-SCAD, right? Now, so this stuff has already been talked about. There was a question yesterday from somebody in the audience, I think, was it you, who asked about PTSD or trauma? Right, and so Katie Sears-Edwards from Stanford is looking at this question of high rates of PTSD, and there's a manuscript related to that will hopefully be coming out soon. So, right, and so, this population has higher rates of anxiety, depression, potentially PTSD compared to typical MI patients. That's just like one of the main things I hope you walk away from this conference understanding. Why is that, though? Why is SCAD maybe more emotionally challenging than a typical heart attack? These are hypotheses. We think they're pretty reasonable ones, but and actually a number of them have already been discussed at this conference too. But it's an unusual diagnosis. It happens to people who have few cardiac risk factors, at least that they know about. So they're not expecting it. There's still lots that we don't understand about why SCAD happens. The risk of recurrence for people can be scary and uncertain. That was also mentioned this morning. There's uncertainty about what kinds of treatments are needed sometimes, although I would say that the state of research, even in the last 5 years since I had my SCAD, has improved quite a bit. And then for some people, a lack of familiarity with activity and exercise recommendations, although that's improving a good deal too, in large part, I would say, thanks to what's happening in BGH. A lack of support sometimes, and a lack of familiarity by physicians, right? So all those things make this diagnosis pretty uncertain and require people to navigate that uncertainty and those questions, which can be really kind of scary in a different way than they've ever had to navigate anything in their lives before. So what can we do? A few skills. First of all, just becoming an expert on SCAD. Health literacy, the degree to which individuals can obtain, process, understand, and apply health-related information is associated with better health outcomes. It's also associated with improved patient compliance and reduction of healthcare costs, right? So know what you're dealing with. I'm preaching to the choir. Y'all are here, right, at this conference. I talked earlier in the session that just let out about the new app that we're developing, which we're hoping to release in the next month or so. We've got to get some videos recorded and stuff, but that is one way we hope that people, even newly diagnosed patients, can get good information about SCAD and also start working on things like stress management and communicating with your healthcare team. That'll be useful. I'm going to skip this slide. I think this is actually an older version of my PowerPoint, but it's okay. Learning how to manage stress. That is, one of the other big take-home points, right? There's lots of ways to manage stress. The important thing is to figure out something that you will do and then do it, right? Mindfulness is certainly, I was talking with someone about this yesterday. Mindfulness I think of as a stress management strategy, but here's the thing, I also think about it as like, it's a safety belt in mental health. It just keeps you in the right place. It keeps you centered, it keeps you in the right sort of position, even when the roads get windy and things get hairy, right? Mindfulness can just help you stay centered. Coping with anxiety and depression. Here's some evidence-based interventions that I would recommend if you are struggling with anxiety and depression. Look for a therapist or try to find colleagues who have some specialization in one of these treatments. One of the recommendations is that from the AHA Science Advisory Team is that people be screened for depression and anxiety, and so if that hasn't happened, ask for it. Get support and skills you might need. Now, we were talking in the last session about this might be a new skill for people, right? Asking for support, because a lot of us are people who just offer a lot of support and don't, things don't run the other way. So I think this is. It may involve some skill development, knowing what kind of help you need and knowing how to ask for it. Finding other SCAD survivors. If you're lucky enough to be involved with Stanford, you could attend one of Katie Sears-Edwards' groups. But I think that there are lots of support groups for SCAD patients popping up. Somebody just handed me a card at the end of the last session for a support group that is now in Manitoba, I think. But there are, this is great news for people, that there are a lot of organizations now to help people. Social media, especially for people who are isolated, who don't get to interact regularly with SCAD survivors, social media can be one way to accomplish that. I would just say that social media can also be kind of overwhelming sometimes. It can be anxiety-producing, especially if you're newly diagnosed, to just, kind of wade through lots and lots of other people's stories and things that haven't always gone well. Can be those kinds of things can just be important to modulate, right? Become an expert on how your post-SCAD body works, and no fair pretending that it's exactly the same as it was before. Cardiac rehab, my goodness. When we did our study, this has just been reported a lot on already at this conference. There are just so many benefits to cardiac rehab, not just physical benefits, but certainly psychological benefits. It is one of the things when we ask SCAD survivors what kind of resource has been most helpful to you, hands down, this was everybody's most helpful resource. So even if you don't have a SCAD-specific cardiac rehab program in your neighborhood, like folks around Vancouver do, cardiac rehab can be just an important source of information and a chance to get comfortable in your new body and just develop confidence in what you're able to do. Assessing values and meaning of SCAD. We talked about this in the last session. Just understanding, coming to grips with what does this mean to you, and how does this shift your values, your priorities, right? So that you can proceed with those new values in mind. There's even on our new app a little module for identifying values. And then finally, just doing what you can do to raise awareness. So this quote from Mother Teresa says, I alone can't change the world, but I can cast a stone across the waters to create many ripples. And I think that just being an advocate for yourself, but also raising awareness in your healthcare community, among your friends, among your family, among people you run into at the grocery store, can confer a sense of mastery, and is an important way to deal with some of that kind of stress and hopelessness or helplessness that sometimes comes along with SCAD. All right, so thanks.